I want you to stop whatever you are doing right now and pay very close attention to the next few minutes, because what I am about to share with you could quite literally save your life. I am not exaggerating. I am not trying to be dramatic. I am a doctor who has spent decades working with patients over the age of 60, and I have watched too many good people, smart, health-conscious people, slowly lose their quality of life because nobody ever told them what was happening quietly inside their body every single morning. And when I say quietly, I mean silently, without pain, without warning, until one day, the damage is already done. Here is something that will shock you. Right now, as you watch this video, there is a very good chance that your kidneys are working at a fraction of the capacity they should be, and you feel perfectly fine. That is the terrifying truth about kidney decline after 60. It does not announce itself. It does not send you a signal. It just quietly, steadily, relentlessly deteriorates. And by the time most people find out, they are already looking at dialysis, or they are being told by their doctor that their kidney function has dropped to dangerous levels. But here is what I need you to hold on to right now, because this is the part that most doctors will never take the time to tell you in a 10-minute appointment. Kidney damage is not always permanent, and in many cases, especially when caught in the early to mid stages, the body has a remarkable, almost extraordinary ability to begin repairing itself when you give it the right conditions, the right environment, the right morning protocol. And that is exactly what I am going to walk you through today. My name is Dr. Raymond, Senior Wellness, and I have dedicated my career to helping men and women over the age of 60 reclaim their health, their energy, and their independence through evidence-based, practical strategies that work in the real world. Not in a laboratory, in your kitchen, in your bathroom, in the first 30 minutes of your morning. Stay with me, because by the end of this video, you are going to have a clear, simple, 3-step morning routine that is specifically designed to support and repair kidney function after 60. And I promise you, this is not complicated. Anyone can do this. You do not need expensive supplements. You do not need a gym. You just need to understand what your kidneys actually need, and then give it to them every single morning. But before I get into the 3 steps, I want to make sure you understand what is actually happening inside your body. Because when you understand the why, the what becomes so much easier to commit to. Your kidneys are 2 fist-sized organs sitting just below your ribcage on either side of your spine. Most people think kidneys just filter urine, but that is like saying your heart just pumps blood. Technically true, but wildly underselling what these organs actually do. Your kidneys regulate your blood pressure. They control the balance of electrolytes in your body. They produce a hormone called erythropoietin that tells your bone marrow to make red blood cells. They activate vitamin D, which is essential for bone health and immune function. They remove waste products, excess fluids, medications, and toxins from your bloodstream every single second of every single day. These are not passive organs. They are working constantly, relentlessly, and silently to keep you alive and functioning. Now, here is what happens after 60. Beginning in your late 30s, your kidney function starts a slow, gradual decline. By the time you hit 60, 70, and beyond, this decline has been going on for decades. The filtering units inside your kidneys, called nephrons, begin to decrease in number and efficiency. Your kidneys become less able to concentrate urine, which means they have to work harder to do the same job. Blood flow to the kidneys decreases. The renal tubules, which are responsible for reabsorbing important nutrients back into your blood, become less efficient. And all of this is happening while many of us are also taking multiple medications, some of which are, frankly, hard on the kidneys. Eating diets higher in processed foods and sodium than we should be, and not drinking nearly enough water. The result is a condition that affects more than 37 million Americans, and the majority of them do not know they have it. It is called chronic kidney disease, or CKD. And while a formal diagnosis requires a blood test and a urine test from your doctor, which I strongly encourage all of you to get if you have not recently. The lifestyle factors that accelerate kidney decline and the lifestyle factors that support kidney repair are things you can start addressing this morning, right now, before your next doctor's appointment. So let's get into it. Let me give you step one. Step one is what I call the kidney flush, and it happens before you eat a single bite of food, before you drink your coffee, before you check your phone or turn on the news. The very first thing you do when you wake up, and I mean within the first 5 minutes of getting out of bed, is drink 2 full glasses of warm water. Not cold water, warm water. And I will tell you exactly why in just a moment. During the night, your body continues to work. Your kidneys are still filtering. You are still breathing out moisture. You are still losing fluid. By the time you wake up in the morning, you are in a mild state of dehydration. Every single morning, without exception. And dehydration is one of the most underestimated threats to kidney health that exists. When you are dehydrated, your blood becomes more concentrated. This means your kidneys have to work harder to filter it. The waste products and toxins that your kidneys are trying to remove become more concentrated in your urine, which can contribute to kidney stones, a painful and damaging condition that becomes significantly more common after 60. And over time, chronic low-grade dehydration causes the kidneys to work under a state of stress that day after day, year after year, accelerates their decline. So the very first thing you do is rehydrate. But why warm water specifically? Because warm water is gentler on the kidneys. Cold water causes a mild shock response in the body that can temporarily constrict blood vessels, including the tiny blood vessels that supply your kidneys. Warm water, on the other hand, supports circulation, helps to gently stimulate the digestive system, and is absorbed more readily by the body. Now, I want you to add one more thing to this warm water, and this is the part that many of my patients tell me was a game changer for them. Add the juice of half a fresh lemon. Lemon juice contains citrate, a naturally occurring compound that has been shown in multiple clinical studies to help prevent the formation of kidney stones by binding to calcium in the urine and reducing the risk of crystal formation. Citrate also helps to alkalize the urine, creating an environment in the kidneys that is less hospitable to the bacteria that cause urinary tract infections. Another major issue for people over 60. And the vitamin C in fresh lemon juice acts as an antioxidant, helping to reduce oxidative stress on the kidney cells themselves. So step one is simple. Every morning, before anything else, drink 2 glasses of warm water with fresh lemon juice. Make it a non-negotiable. Set your glasses out the night before. Put a lemon on your counter as a visual reminder. Do whatever it takes to make this the first thing that happens every morning. Your kidneys are begging you for this. Now let's move to step 2, and this one involves movement, but not the kind of movement you might be thinking of. I am not asking you to hit the gym at 6 a.m. I am not asking you to run or lift weights or do anything that feels overwhelming or hard on your joints. What I am asking you to do is spend 10 minutes doing gentle, kidney-stimulating movement. And the most effective form of this for people over 60 is a specific combination of gentle walking and lower back activation exercises. Here is why movement matters so much for kidney health. Your kidneys receive approximately 20 to 25% of your total cardiac output, meaning nearly a quarter of everything your heart pumps goes directly to your kidneys. When you move your body, your heart pumps more blood, and that increased blood flow delivers more oxygen and nutrients to your kidney tissue. It also helps flush out metabolic waste products more efficiently. Research has consistently shown that regular, gentle exercise improves kidney function markers, including estimated GFR, which stands for glomerular filtration rate, and is the primary measure of how well your kidneys are filtering your blood. But here is something most people do not realize. The kidneys are located in what is called the retroperitoneal space, which means they sit behind the abdominal cavity, nestled right next to the muscles of the lower back. Gentle movement that activates the lower back muscles, the muscles right around where your kidneys sit, actually helps to stimulate blood flow directly to the kidney tissue through a mechanism involving the local vascular network. This is why certain yoga poses that stretch and gently compress the lower back area have been used in traditional medicine for kidney support for thousands of years. And modern physiology gives us the biological explanation for why they work. So here is what your 10 minutes looks like. Start with 5 minutes of gentle walking. Indoors or outdoors, it does not matter. Walk at a comfortable pace. Swing your arms naturally. Breathe through your nose. This wakes up your cardiovascular system, gets blood moving, and begins that kidney perfusion process we just talked about. Then spend the remaining 5 minutes doing these simple movements. Gentle seated or standing forward folds, where you hinge at the hip and let your upper body hang, feeling a gentle stretch along the lower back. Gentle side-to-side trunk rotations while seated or standing. And the kidney tap, which is something I teach every single one of my senior wellness patients. Take your fists and very gently tap the area on your lower back, right below your rib cage on either side of your spine, about 20 to 30 times. This gentle percussion helps stimulate blood flow and lymphatic drainage in the kidney region. It feels wonderful. And the research on percussive stimulation in traditional Chinese medicine aligns remarkably well with what we know about local tissue perfusion in Western physiology. 10 minutes every morning after your lemon water. That is step 2. Now we come to step 3, and this is the one that I consider the most powerful of the 3, and it is also the one that is most commonly overlooked, misunderstood, or flat out ignored. Step 3 is what you eat, and specifically what you eat in the morning. The typical American breakfast is an absolute disaster for kidney health after 60. Processed cereals loaded with sodium and phosphorus additives, bacon and sausage, high in sodium and saturated fat that stresses the renal vascular system. Pastries and white bread that spike blood sugar, because uncontrolled blood sugar is one of the top 2 causes of kidney damage worldwide, the other being high blood pressure. Orange juice from a carton that is frequently higher in sugar than soda. These are the foods that are silently, steadily loading your kidneys with work they are increasingly unable to do efficiently. So what does a kidney repairing breakfast look like? It is built around 3 principles. First, it is low in sodium. The kidneys are responsible for regulating sodium balance in the body, and excess sodium forces them to work harder, raises blood pressure, and contributes to fluid retention, all of which accelerates kidney decline. A kidney-supportive breakfast contains less than 400 milligrams of sodium, and ideally it contains ingredients that are naturally sodium-free or very low in sodium. Second, it is rich in antioxidants, because oxidative stress is one of the primary drivers of kidney cell damage. The kidney tissue is extraordinarily metabolically active, which makes it highly vulnerable to free radical damage. Antioxidant-rich foods neutralize free radicals and help protect the nephrons from damage. Third, it is moderate in protein. Now, this is a nuanced point that I want you to pay close attention to, because there is a lot of confusion about protein and kidneys. Protein is not the enemy. You need protein, especially after 60, when muscle loss accelerates and adequate protein intake becomes crucial for strength and mobility. But the kidneys are responsible for filtering the waste products of protein metabolism, and a very high protein breakfast puts significant filtration demand on already stressed kidneys. The goal is not to eliminate protein. It is to be smart and moderate about it. So what does this breakfast actually look like? I want to give you a specific, practical example so you can visualize this clearly. Start with half a cup of cooked oatmeal, steel cut or rolled oats, not instant oats that are loaded with sodium and sugar. Oats are rich in a type of fiber called beta-glucan that has been shown to support kidney health by reducing cholesterol and stabilizing blood sugar. Top that oatmeal with a small handful of blueberries, which are one of the single most kidney-protective foods that exist. Blueberries are rich in anthocyanins, which are potent antioxidants that have been shown in research to reduce inflammation in kidney tissue specifically. Add a sprinkle of ground flaxseed, which provides omega-3 fatty acids that reduce systemic inflammation and support renal vascular health. And pair this with a cup of unsweetened herbal tea, specifically dandelion root tea or nettle leaf tea, both of which have been used for centuries as kidney tonics and have modern research showing they support kidney filtration and help reduce fluid retention without stressing the kidneys the way pharmaceutical diuretics can. This is not a difficult breakfast. It is not expensive. It is not time-consuming. But it is fundamentally different from the typical American breakfast in ways that matter enormously to your kidneys. Now, I want to take a moment before I close to talk about something that goes beyond the 3 steps. Because I have been doing this long enough to know that information alone is not what changes people's lives. What changes lives is understanding the urgency, understanding what is genuinely at stake. If you are over 60 and your kidney function is declining, even mildly, the downstream effects touch every single system in your body. Your blood pressure becomes harder to control. Your bones become more fragile because your kidneys are less able to activate vitamin D. Your red blood cell production drops, leading to fatigue and anemia. Your heart works harder because fluid regulation becomes impaired. The toxins that your kidneys would normally filter start to accumulate at low levels in your bloodstream, affecting your brain clarity, your energy, your immune function. Everything is connected. The kidneys are not just a filtering system. They are a regulatory hub for your entire physiology. And the cruel irony is that most of the damage happens before you feel a single symptom. By the time you feel the swollen ankles, by the time you notice the foamy urine, by the time the fatigue becomes impossible to ignore, by that point, significant damage has often already occurred. Which is why the morning routine I have just described to you is not something to start when things get bad. It is something to start right now, this morning, regardless of how you feel. Because your kidneys deserve proactive care, not reactive care. Let me bring this all together for you one final time, because I want these 3 steps to be crystal clear in your mind. Step 1. The moment you wake up, drink 2 glasses of warm water with fresh lemon juice. Hydrate your kidneys, flush out the overnight accumulation of waste, and provide citrate to protect against kidney stones. Do this before anything else, before coffee, before breakfast, before your phone. Step 2. Spend 10 minutes doing gentle kidney-stimulating movement. 5 minutes of easy walking, followed by 5 minutes of gentle lower back stretching and the kidney tap. Get blood flowing to your kidney tissue. Wake up the filtration system. Step 3. Eat a kidney-repairing breakfast. Low sodium, rich in antioxidants, moderate in protein. Oatmeal with blueberries and flaxseed, paired with dandelion or nettle tea. 3 steps, 30 minutes or less. And if you do this consistently, not perfectly, but consistently, the research strongly suggests that you can slow the progression of kidney decline, reduce inflammation in the kidney tissue, improve your filtration markers, and, in many cases, support a meaningful degree of functional recovery. I have seen it happen with my own patients time and time again. If this video has been helpful to you, I want to ask you to do something right now. Hit that like button because it tells YouTube that this information is valuable and helps me reach other people over 60 who need to hear this. Subscribe to this channel if you have not already, because I put out new videos every single week on exactly these kinds of practical, evidence-based strategies for senior wellness. And leave me a comment below. Tell me, have you ever had your kidney function tested? Do you have a morning routine right now? I personally read every comment, and I want to know where you are on your health journey. And finally, if you know someone over 60 who would benefit from this information, a spouse, a sibling, a friend, a neighbor, please share this video with them today. Not tomorrow, today. Because the sooner they start, the better. You never know whose life you might be changing with a single share. This is Dr. Raymond Senior Wellness. I will see you in the next video. Take care of yourself, because you absolutely deserve to.